Mindbody Talent was delighted to have our CEO, Robin Stewart, interviewed by Amanda LaPlante on her healthcare podcast radio show, Get Real to Heal. Robin and Amanda discussed three important topics: the rapid rise of functional medicine and its impact on healthcare, Mindbody Talent's role in helping to fuel that rise, and the innovative Novus Health model of enhancing healthcare practices through the first functional medicine franchise. Mindbody Talent has a strategic relationship with Novus Health to recruit franchisees and personnel, as well as to optimize practice operations. This video is a copyright of Get Real to Heal and Amanda LaPlante. We hope you enjoy the show.
This is Amanda LaPlante, and you're listening to Get Real to Heal on KWRH 92.9 FM. You know, I struggled with mental and physical health challenges for decades, went through quite a lot, and really went through the ringer with the conventional medical system. And there was a particular approach that I discovered a few years ago that really turned things around for me, and that is what I'm very passionate about sharing. And so I'm very excited to have here with me today Robin Stewart. Robin Stewart is the co-founder, CEO, and managing director of Mindbody Talent, LLC. Robin co-founded Mindbody Talent based on more than 2 decades serving leadership roles in business solutions, architecture, operations management, and executive recruitment. Most recently, Robin's company has formed a strategic partnership with Novus Health, the world's first functional medicine franchise, delivering affordable and accessible functional medicine to the patients that they serve. And so, welcome to the show.
Thanks, Amanda. I really am happy to be here. Thanks for inviting me.
It's so good to have you here. I've enjoyed the conversations that we've had thus far, and I feel like there's just so much that resonated. And there's just commonalities, common ground.
We could talk about it forever, right?
Yeah. And so, you know, in your company, you've chosen to focus on certain fields of healthcare, popularly called functional, integrative, and lifestyle medicine. So tell us a little bit more about that. What are those fields and why did you choose them? I know why I'm passionate about them.
Yeah. So I guess I'll start with the second part of your question first and answering that. And because I think it really speaks to our why and the mission of Mindbody Talent and who we are as founders. So, you know, we all have our own healthcare stories, you know, whether that is our own recovery from chronic illness or battling autoimmune diseases. We have relatives, personally, were challenged with it, coworkers, colleagues, any family members. We could go on and on. And I think that, you know, when I looked at my own chronic illness and an autoimmune disease, battling Hashimoto's thyroidism, which I've been battling for a decade, you know, getting hit with it in my mid-40s, thinking, you know, this is really terrible. You know, I was putting weight on like it was my job. My skin was kind of ruddy looking, and, you know, I'm like, what's going on? So, you know, I was being treated by an endocrinologist and, you know, automatically right away get on the liothyronine and, you know, spent maybe 15 minutes with me and there's the prescription. So, you know, being raised on conventional medicine, like probably most of the people listening today, you know, I started taking the prescription and it didn't get any better. It actually got worse. So it wasn't until I discovered functional medicine and really was able to understand myself that I had power to heal, because I had doctors that were really looking at the root cause of my illness and treating it at the source. And, you know, I've learned to stay away from gluten and nightshade vegetables and eat more celery and more blueberries for antioxidants. So I really am in a position where I can, you know, have control of that. So we believe as a company and as founders that functional, integrative, and lifestyle medicine is the path forward to healing, and only the true path to that healing. So it's exciting.
I love that. And, you know, even just as recent as just a few years ago, I guess it was about 5 years ago, almost 6 now, that I started this health journey of mine. And I remember hearing for the first time about food as medicine because, you know, I'd never been introduced to that. And, you know, and then learning through that path, as I started to fall down the rabbit hole with nutrition, I learned about functional and integrative medicine.
Great.
And these different approaches. And of course, there are different nuances to each of these, but in general, the underlying driver, I think, for these, right, is, you know, getting to that root cause, really helping people to address and build health rather than just masking symptoms. And I think that's super important. There's I always want to make sure and make the distinction personally, though, that, I really do believe that all of my doctors in my conventional experience that I had, and I had many, many, many doctors,
No doubt.
they really were doing the best that they could with what they knew how to do. This is a totally different model.
Right.
This is a totally different way of doing medicine. And I love that your company is stepping into this. And so part of the problem that I see with different providers I work with is, they've got this new approach to medicine that is a lot, oftentimes, post-doc work, if you will, that they're learning clinically, and then they're seeing things differently, and they have to go on for additional education. They're learning this different way of approaching cases, different way of doing medicine. And then they find that the insurance system doesn't necessarily want to back them. The system that they're currently in doesn't really want to embrace this yet. We're making strides, but it's slow because we're turning the bow of a huge ship, right? And what I love about your company is not only are you, helping to get these systems in place so they can practice this form of medicine more effectively, but you're helping to ease some of the burden of the business aspects that they run into.
Absolutely.
Because I see so many providers that are really passionate about this, and they step out and they're trying to do the right thing for their patients and themselves and their career, and look at things from this totally different paradigm. And then they also have to learn to be an entrepreneurial doctor, and that is no small task.
No, absolutely not. So you mentioned something really interesting, and I'm going to start with mentioning food as medicine. So most of the conventionally trained physicians have 0 to 3 hours of nutrition training in medical school. And the majority of that time is spent on how the body digests that food once it's eaten. So that's their whole nutrition experience during medical school. So their understanding of it and how food can treat root causes and treat healing is a mystery. So the fellowships in functional, integrative, and lifestyle medicine really do allow them to explore those pathways to be able to have something else in their toolbox to offer their patients for healing. So you bring up another good point about now turning this into a business for practitioners, because it is not. So the traditional model says, with healthcare reimbursements, you get 9 minutes to spend with each patient before the next one comes in, because it's not profitable if you can only see 6 patients a day. So on average, doctors are seeing between 25 and 30 patients a day in conventional medicine. So, and after 9 minutes with a patient, in about 90 seconds, they're summing up exactly what the diagnosis is. After listening to them, the doctor shuts down, takes over control of the conversation, and then is trying to figure out what diagnosis they're going to have so they can fill out their prescription medication out the door so they can see the next patient. And with functional and integrative and lifestyle medicine, that first initial visit with a patient is 90 minutes. They're asking questions like, were you, a vaginal birth, or were you a C-section? Were you breastfed? And when was the first time you had the flu? Because all those things matter. And if you're trying to figure this out in 90 seconds in a conventional appointment, you're going to miss all that. So there's a lot of factors that come into play with that. So transitioning into the business model, like how does the doctor, the physician, now apply this and put it into practice? Is it's a challenge.
Absolutely, it's a challenge, and I love the way that you're coming at this. So when you think about the crisis in healthcare that we're currently experiencing, how do you sum up what is broken?
We only have 30 minutes. I don't know if we can do that. So what is broken is that we've been fed this agenda for healthcare, which is largely driven by the pharmaceutical company. Post World War II, the pharmaceutical companies, the chemical companies, were all target marketing to farmers and doctors and consumers pharmaceutical drugs. And, for a period of time, we were rather enamored by the science of all of that. But now fast forward, we're in epidemic proportions with chronic and autoimmune diseases. So here's a few facts. In 1965, just 55 years ago, only 4.6% of the population had a chronic illness. Today, half of America has a chronic illness. That's about 117 million people. 46% of our kids have chronic autoimmune diseases. And, if you look at the proliferation of pharmaceutical drugs, 2.4 billion prescriptions were written in 1997. In 2016, 5.4 billion have been written. So that's an 85% increase when we're looking at just a 21% growth rate of the U.S. population.
I'm sorry, when you said 46% of our children have autoimmune diseases,
Oh, Amanda, I'm sorry.
Oh, it's okay.
Yeah.
In my own family, I've seen that, and it makes me angry.
It should.
It makes me mad.
It
and
should.
it makes me mad that I had to go through what I had to go through. I lost precious time with my son. I lost years of vitality, in my early 30s, in my 20s, and it didn't have to be that way.
No.
It doesn't have to be that way. And with everything going on in the world right now, my emotions are constantly just just out there, folks. But this is a trigger. This is a hot button topic for me, and it means so much.
Yeah.
And this work is very important. And I really, studying through the Institute for Integrative Nutrition, when I was first studying for health coaching, becoming certified there, one of the things that the founder had said in one of our lectures was, he said we had modern healthcare, and that's broken. Functional and integrative medicine is postmodern healthcare. It's the next thing. It's okay. We've got the procedures, the pills, the chemistry, all of the science when we need it. Let's get back to basics, and let's build health instead of masking disease.
Yeah, for sure. And I've had to retrain myself to stop referring to conventional medicine as traditional, because there's really nothing traditional about it. It's only been around since World War II, when penicillin came out, and I think that traditional medicine in its most definitive terms is really functional medicine. That's the stuff that used to work hundreds of years ago, right? That was the things that our body is hardwired to know how to fix it. Our body is hardwired to know what provides an inflammatory response and what kinds of things we should not eat. I was sitting with a doctor yesterday, and we were talking about just listening to your body after you eat. When you have some congestion and when you start sneezing and you start to feel achy, you have to think back 2 hours ago. What did I just eat? What caused that? Well, maybe I should stay away from that next time. And if you have chronic sinusitis, you don't run and get Claritin. I mean, for some people that you need that, but I don't necessarily think that there's a pill for every ill. You have to look at environmental factors and food and nutrition and lifestyle. I mean, obesity is the number one chronic illness we have in this country. And it's not getting any better.
Absolutely.
Yeah.
And all of the reasons for it, folks. It's not willpower.
It's not willpower.
Just going to start there, and I'll digress because we could do an hour on that.
For sure. Yeah. No question.
Yeah. But sorry, so much. All right. So you're part of the solution. We see this as a solution, right? And I love what you said there. So I am going to go back and touch on. What functional and integrative medicine does well is takes what we know now, takes science that we have, right, and combines it with the ancient arts. Medicine is an art.
Sure.
And it combines it with, some perspectives from Chinese medicine, Ayurveda, these modalities that were working for thousands of years. They worked for millennia. Were they always able to conquer a plague or a pandemic? Well, maybe not. But there's merit there, and there's health building principles there, and we need to turn back to that. And so that's what I love about this approach is it really is starting with the basics, building from the ground up. So I want to go back to, how does your company, Mindbody Talent, how does it play a role in all of this?
So if we want to look at the solutions architecture of this, Amanda, I would first start by saying awareness, right? We as, the health population understand that if we continue down the path of pharmaceuticals and we continue to just compound one prescription after another and the contradictions that come with that, and then we get another prescription for that, and then before you know it, we're on 5, 6, 7, 10 prescriptions when we first entered the doctor's office for one thing, and it's just this proliferation, right? So we have the awareness, and understanding what our bodies are telling us and what's on the end of our fork, it matters. The access to good quality nutrition is a big part of that. So having the awareness that there is an alternative out there, and when I say alternative, I don't mean alternative medicine, because you got to be really careful. Functionally trained doctors, integrative medicine doctors, they are medical doctors, doctors of osteopathy, nurse practitioners, family medicine providers, and they've all received their board certification in their various specialties, and they've gone on and done fellowships because they realize and understand that there's more to just diagnose and prescribe in a revolving door. So they have the awareness. Many of them are moving over into functional medicine, and as patients, we have to have the awareness. So awareness is the first thing. And secondly is getting at the root cause. We want to get at the root cause of what's creating the autoimmune disorder or the chronic illness and fix it. I heard a great analogy to best really define this, and this doctor said, if you're taking a prescription drug, that is the equivalent of when your smoke detector goes off, you get up and disable the smoke detector and go back to bed as the fire is still raging on, right? So getting at the root cause of what is creating the problem, and then between you and your doctor, developing a care plan. How do you get out of that? So you move from, yes, I've got this disorder, I'm aware of it, I've got at the root cause, and now what am I going to do about it? And it doesn't happen overnight. You didn't get that autoimmune disease in 3 months, and you're not going to get rid of it in 3 months. So it's patience. Steady wins the race.
And thank you so much for that analogy, because I'll tell you what happened in my own temple, if you will. I took the pills and I disabled the alarm. And then, the disease, the chronic inflammation that was there, found another weak spot in the dam and it popped right through, right? Disabled another smoke alarm by taking the pill. And I just kept doing that until the next thing you knew, I was on over a dozen pills a day. And I was 32 years old when that started. And they were looking for a quote unquote drug cocktail to put me on to try to manage all my symptoms, but nobody was talking about, hey, could it be the gluten? Could it be the sheer utter lack of vegetables in your diet? Could it be the trauma from sexual, issues like rape? Could it be these other factors that were tearing at my soul and destroying my body? Let's give that a pill.
Right.
And that's where we have to change. There's a time and a place for it. There's still one pill that I take daily. It is it's a methylated folate, actually, for a nutritional issue that I have from a genetic abnormality or mutation. But there's a time and place for these. But my goodness, I love that analogy. Thank you for sharing that.
Of course.
It's just powerful.
I have to give Christine Gedrick credit for that. She's a fabulous doctor in New Jersey. Has a wonderful book called The Nation of Unwell. If you haven't read it, you got to pick up a copy. It's just hardcore awesome. A Nation of Unwell.
A Nation of Unwell by Dr. Christine Gedrick. All right, great. I will totally check that out.
Great.
Ooh, this has been an emotional episode, Robin. This is fun. Thank you for being here. All right, so let's talk back about the types of providers that would benefit from working with Novus Health and the new franchises that you're working on.
Okay. So, as you mentioned in the introduction, Amanda, and I really appreciate you sharing that, because, I think up until, recently, functional medicine has been not accessible to everybody. And Novus Health was founded by Dr. Ryan Valencic and Dr. Ruben Valdez for the purposes of making functional medicine accessible and affordable to everyone, and to be able to put a business solution in place for practices that was turnkey operations. So I think first and foremost, as we look at functional medicine and on the franchise model, practitioners and providers that are going to be looking at this are going to be really being able to benefit from the heavy lifting of what these doctors have done, because they are doctors that know how to treat patients well. That doesn't always that medical savvy does not always translate into running a successful business practice. So this is locked and loaded, one and done turnkey. You walk in, branding and marketing is done, patient acquisition is done. They've got tremendous programs that get, as I mentioned earlier, having that care plan, the programs that they're able to help their patients that are coming in with, whether that's type 2 diabetes or whether that's thyroid issues, and then other obviously complex chronic autoimmune disorders that they can help with. But the functional medicine franchise is going to be attractive to practitioners that are really looking to move into functional medicine, whether they are experienced or a new provider, and then have access to everything that's done for them. So they walk in and the business is set up and all they have to do is see patients.
Gotcha. All right. So it solves a lot of problems there that
most definitely
they run into.
Mm-hmm.
So what types of programs or what types of focuses is Novus Health really zeroing in on?
Okay. So I think the most important thing to understand is that in functional medicine, the two types of illnesses that are most common and most easy to treat, and I don't mean easy to treat like all you have to do is this and then that's all there is to it. Easiest to treat because there are not gazillions of underlying issues when somebody comes in with like MS, for example. So the two programs I'm talking about specifically are type 2 diabetes and hypothyroidism, because those are the most, those are the highest propensities of autoimmune and chronic illnesses in our country today. We talked about the increased number of people that have chronic illnesses today. Well, most of them are that.
Right.
And so when we think about that in terms of what those are and how they're managed, these programs put people on systematic. Every single month they're in and they're being checked and they're being regulated and they're being fine-tuned. So these programs continue to keep people on a path for health and wellness, not just disease management, which is what has happened traditionally. So, at the root of it, this is still a business, right? Functional medicine doctors are running practices. They need to be profitable. They need to be able to serve their patients. Putting people on these care plans that have these disorders and diagnoses, they're coming in every month and they're getting help every month. So this is a very systematic approach to being able to help these folks with these illnesses.
Okay. Yeah. And that makes absolute and total sense. And, when you look at the numbers with regard to thyroid disorders and type 2 diabetes, and you see that you can launch an entire franchise business off of just helping this niche of patients, does it shock you?
Does it shock me?
What it brings up a lot of feelings. It brings up a lot of emotion for me to look at the state of health in America today and to understand that these two very preventable issues are number one.
It does, and you said one word that is at the heart of it, and that is preventable. So I actually remember having a conversation with Dr. Valensik, and he said those two diseases are choices. People make choices. They don't go out and say, I want to, get type 2 diabetes, but every action and decision that they make creates a path for them to go on to become, another statistic. So it's not shocking, but it is sad.
It's disheartening. And, 90% of diseases, all diseases diagnosed are somewhere around 90% are rooted in chronic inflammation, and those are diseases of diet and lifestyle.
Exactly.
And that is exactly where we can fit in and serve
Mm-hmm.
and serve well.
Mm-hmm.
I love that. All right. So if a practitioner was interested in going down any of these paths that we talked about today and being part of this change, how can they get started?
So Mindbody Talent, we are not confused about what our role is, okay? We're not doctors. We are not practitioners. This is not a small evolution. This is a healthcare revolution that we are in right now. And our job, and our job is really to make connections and to be able to put practices and practitioners in places where they can have the greatest amount of impact in this healthcare revolution. So when I think about what that looks like. And my partner, Rich Hoffman, who has spent, 30 years or so in health services and technology in Silicon Valley. So he's brought a lot of that expertise to our company to be able to help with transition plans for physicians that are looking to, segue into functional medicine. So at the root of our company, with recruitment and candidate placement in functional and integrative medicine, so, I've spent 20 years or so in that discipline, and most recently, obviously, working with physicians to place and recruit. But the second part of this, I guess, was what we're, mainly talking about today is bridging that gap. So physicians that are coming from conventional medicine, we have a 12-week mentor program that moves them and pairs them with, top functionally medicine trained doctors that they can put together a mentor program and segue them into functional medicine. So, at the core of what we're doing, we're trying to, match the patient and the provider with the practice, right? And then we're trying also to bring as many people from conventional medicine into functional medicine by bridging that gap to be able to provide them with mentorship. Because the transition is not easy. It's, you're going from 9 minutes with a patient, here's your prescription, I'll see you never, to 90 minutes, right? I mean, what do you do with all that time? So the gap is significant. So the mentorship program that we have helps tremendously with that. There's also
and Robin, we're down to about 30 seconds. I want to make sure that we get, this is all such great information. I'd love to have you back again to talk.
Okay.
And I know you've got a wealth of information out there available online. I want to make sure that we let people know how they can reach out to you so that they can get more.
Okay, so I can be reached at robin@mindbodytalent.com. My telephone number is 310-890-7489. And if I could just leave with 2 parting points, if our listeners don't remember anything else except, the first thing is that our healthcare system is broken, and we can do our part in being able to get on top of all those issues.
I love it. Robin Stewart, thank you so much for joining us today. This has been Amanda LaPlante. You've been listening to Get Real to Heal on KWRH 92.9 FM. I am an integrative health coach. If you need any help on your health journey, I'm happy to be here for you. Reach out to me at amandalaplante.com or at 314-583-6749. Go make it a great day. You're worth it. Love you.
Many thanks to Amanda LaPlante, Get Real to Heal, and KWRH 92.9 FM for hosting this video. For more information, you can explore Mindbody Talent on our website, on all social media venues, or by emailing Robin Stewart directly at robin@mindbodytalent.com.